me. It's a real privilege and a pleasure to have the opportunity here to offer you my view on where to go from here, the next steps for health literacy. I was not so wise as Ilona was. I prepared slides, and so I have to talk with you about what I was thinking on Friday concerning these issues, but you will see much of what I saw on Friday I can still offer you today after we had this wonderful day of these many very, very interesting discussions and introductions we had here. I have to warn you before about my formation professionnelle. You see, I spent 2 decades trying to reorient health services by building up the Health Promoting Hospitals network for WHO. I did the migrant-friendly hospitals project, and in the last years I was very much involved in measuring population health literacy. Well, health literacy is a very attractive concept. It brought us together today. Many, many people are jumping on it. One has the feeling, and many people are using it for their purpose. And there are some interesting characteristics why this concept is, as Ruben would say, a valuable concept. Well, health literacy can be defined, but there are still limited consensus and definitions, and I know within our community there's a debate if this is a good or bad thing. But health literacy, and I think that is one of the specific characteristics of it, and the owner was very much arguing that just before, health literacy can be measured. But again, by a number of instruments differing in scope, content, and psychometric qualities, and it can be measured in different ways for general populations, and there are rather few studies, one has to say. It can be measured for specific vulnerable groups, especially patients, and there we have a lot of studies, and it can be measured for systems, organizations, services, products, and there again we have very few studies. The interesting thing about measuring is we can compare cross-sectionally and longitudinally, which is very important, I think, especially for practice and for politics, that we measure longitudinally and that we see what are the effects of the political and health promotion measures, the health policy measures we have used. And of course, it's a determinant of health, I think. It is a specific determinant of health. It's one which can be intervened or taken into account, and there are quite two different kinds of strategies to go about it. On 2 levels, improving competences of people and decreasing demands of systems, organizations, services, products. Again, the last one is much less explored yet. Second, there's available, partly contradictory as we know, and fragmented knowledge on distributions of health literacy and associations with social causes, with conditions, with determinants of lower health literacy mostly, about vulnerable groups with lower health literacy, and of health relevant consequences, again mostly of lower health literacy for health behavior, use of services, and for costs. You see from the HLSAU study, we learned, I think, 4 things. The first one is health literacy is not only complex, but because it's complex, it's very diverse. Therefore, you see we have to measure in every country, because what we learned, there are differences between countries, and not only for averages or distributions or standard deviations, but there are quite strong differences concerning associations. You saw the one slide of Christine. There are countries where there is a relationship to age, and there are countries where there is no relationship to age. And we can show that for many other social indicators that there are really big differences, partly on a matter from 1 to 4, concerning beta coefficients in multivariate regression analysis, for example. Another thing, what we learned, of course, here, that is not just a characteristic of our measure. The same we found for the NPS test, which we have included in our questionnaire, and the same we found for self-assessed health. Therefore, I would like to concentrate on just 4 or maybe even 3 main deficits or challenges which I see for research practice and health policy from a public health perspective. First, what Ilona was talking about, we need population measures, we need them continuously, we need them for a comprehensive form of measure, we need them economically, so therefore we need short forms, and we have to be able to make comparisons and benchmarking. Second, you see, I really love the concept which has been quoted today so often by Razan and Ruth Parker. Health literacy is about personal competences and about situational demands. It's a relational concept, it's a contextual concept, but you see there's a real imbalance. Still, we have said that I was very much liked that we heard today that we should invest more in organizational change and development, and I was very much impressed by what is going on in Australia, and of course the work Marat did and this institute did concerning health organization. But still, we don't have many measures for the health. We have characteristics, but we don't have many measures for the health organization, and we don't have many studies measuring that. And I think we will take this concept seriously. We have to measure on both sides, on populations, on the system side. But of course, if we want to improve systems, only measuring, of course, is very important for arguing, especially for politics. But at the same time, as we can learn again from Australia today, where they were talking that it's important that users or clients or patients are included in planning and governance of the systems. And you see in the country in Europe where our data were best, who have the highest health literacy, that is the Netherlands. And the Netherlands have a very good developed system where patient representatives are included at all levels of the healthcare system. And that's, of course, an interesting way of making the healthcare services more health literate, because the users have a direct say in planning and in governance of these services. I will say a little bit more about the studies we need, and the last point, because I think that is very important in our context. You see, what we need, I think, is a much more systematic and sustainable integration of health literacy in healthcare services. Till now, usually we were just looking at low health literacy, and we were measuring it, or we were trying how to deal with patients with low literacy. But from a public health perspective, the real goal has to be, we have to use our healthcare services to improve health literacy, and to improve it not only from the low literate patients, but from every patient. Every patient, you see, it's a teachable moment, it's a window of opportunity. We really have to have a healthcare system. When you have a contact to it, you have to have after that better health literacy. You know this NHS strategy, which is now make every contact count. Where do we go from here? You see, you might think that's a little bit visionary, but I'm taking up here from Ilona Kikush and Razan and others to see from a public health perspective, we need health literacy as a health index for societies. We need it as a measurement of health development. That's the one example. The other example is WHO's health behavior in Schule's children study, which was developing from 5 participating countries in 1983 to 40 in 2009. And what we really need here is not just to have networks, but to have an international project like that. It has to be an open project. It can start with few countries, and it has to be open too in the way that we need core measurements there, and every national society must have the possibility to add certain specific things to it. And I think that was part of the characteristics which makes these projects very flexible enough and sustainable at the same time. And of course, if we want it as a public health measure, in the end, what really is needed is that health literacy is included in official health statistics and in health reporting. Well, what can be next steps to these goals? Of course, there are difficult goals, to have this continuous population measurement, to put much more stress on measurement of systems. What I think we should do here, we really have to start, and here are so many people who can do that very well, is agenda setting, alliance building, and allocation of resources. To go into this direction, we should form international working groups with clear goals, time frames, and resources to start and prepare some open international projects. And I think concerning these projects, especially for the project where we will, which is about comparative population studies using these instruments, we need very strong leadership. Best would be to have leadership combined by OECD and WHO. That I think would really, concerning our topic, is the best kind of leadership. And of course we have to try to convince these people. But concerning this other goal, which I think is so important, to really reorienting health services towards health literacy, IOM, our host here, really can have very good leadership concerning that. And maybe from Europe, IOM Foundation, where Ilona Kitbush is involved, could help so that we could have an American, European initiative to go into this direction and to make that more, to have a more radical mission and aim here. And I would like to invite all of you to help that we can try to tackle these three very demanding, but I think very important